Good afternoon, and thank you for joining us today. I'm joined today by Tony Stack, CEO and Director of Education with the Newfoundland and Labrador English School District, as well as by Skype, Ms. Kim Christensen, Director of Education with the Francophone School District. Yesterday, the Chief Medical Officer of Health, Dr. Janice Fitzgerald, provided an update where she moved the Avalon region to Alert Level 4 and the Central, Western, and Labrador regions to Alert Level 3. With these changes in alert levels, there are corresponding changes to our education system. This has been an interesting 4 weeks for our students and our educators, but I think both groups have risen to the challenge in a remarkable way. While there have certainly been some challenges, there have also been many stories of how educators have kept classes interesting and informative. I have to say that I am very proud of our educators and our students. While having all students in the classroom full-time would be the ideal situation, the pandemic and the resulting protocols put in place by public health to keep our school community safe will determine how our classrooms look as we move forward. During the past 4 weeks, we have heard a lot of feedback on our plans from teachers, students, and parents. We've heard mostly positive feedback around online learning at the high school level. At the same time, I know that it was also a relief for many when students in the K-9 system returned to the classroom as a result of the changing alert level outside the Avalon. Scenario 2, or the blended learning model, has only been in place for a week or so in some Central, Western, and Labrador schools. This approach was incorporated into schools that could not abide by the 2-meter distancing requirement put in place by the Chief Medical Officer of Health for high school classes. Scenario 2 was originally envisioned to be a short-term measure. It was never our intention to offer 50% instruction long-term. Given recent discussions that we've had with the Chief Medical Officer of Health, it seems that the 2-meter distancing rule for non-cohorted classes will be in place for the foreseeable future. Therefore, we need to look at the approach that can be implemented most effectively over the long term to follow public health guidance. As a result of this, what we have observed and what we have heard in consultations with stakeholders, including the NLTA and the Federation of School Councils, today we are announcing changes for every region of the province. Based on the advice of the Chief Medical Officer of Health, effective Thursday, March 18th, students in the Avalon region from kindergarten to grade 9 will join the rest of the province and resume in-class instruction. We chose Thursday to provide 2 transition days, just as we did for areas outside the Avalon Peninsula. With Monday of next week being a holiday, these 2 preparation days will be Tuesday and Wednesday. While we recognize that it is always better to have students in schools, in person, full-time, this is not possible right now for many of our high school students in light of the current public health advice. High school classes are not cohorts with the same classmates throughout the day, and where they cannot maintain 2 meters of spacing as prescribed by public health, we need to take other measures. For high school students, the changes are as follows. High schools on the Avalon Peninsula or in the Avalon region will continue with online learning. This will be reevaluated after Easter in consultation with public health. High school students in areas outside the Avalon who are currently undertaking learning known as Scenario 2 will revert to online learning. This impacts the 50 schools originally identified for blended learning. Given the size and space within the Francophone School District and their classes, they will revert to Scenario 1. Any smaller schools with classrooms that can operate safely in full-time in-class learning within the English School District while maintaining the 2-meter physical distancing will continue to offer regular in-class instruction. The majority of students are responding well to online learning environment. There are some with challenges, and to address this, the department and the school districts will put additional resources in place, including additional term contracts for substitutes, to bring the total to 100, which includes existing and new. We believe that this approach is in the best interest of all students for several reasons. For K-9 students, it prioritizes in-class instruction. It maximizes student learning, and it lessens the burden on parents for childcare. For high school students, the approach recognizes the required 2-meter physical distancing rules while maximizing teacher instruction and student learning, and affording students with the best opportunity to complete all curriculum outcomes. As Dr. Fitzgerald mentioned yesterday, students in the K-9 system within the Avalon region who are returning to class will follow the same enhanced safety protocols the Chief Medical Officer of Health recommended for outside the Avalon. For students between grades 4 and 9, they will now wear masks in school for the entire day, and students between kindergarten and grade 3 are encouraged to do so as well if they are able. Secondly, teachers and staff will be required to wear level 1 medical masks in addition to eye protection. We have provided this in the form of face shields, but teachers can also wear goggles. Finally, on childcare, as indicated by Dr. Fitzgerald yesterday, and as we've previously announced, it is now safe for regulated childcare services to return to full capacity in the Avalon region, provided they follow the enhanced public safety protocols. As with other regions, this change will we will no longer be reimbursing childcare centers for fees of absent children. I want to be clear, however, that any regulated childcare service required to close due to contact tracing or a positive case of COVID-19 will continue to receive their full compensation when they have to close. I want to thank Dr. Fitzgerald and her team at Public Health for their continued guidance as we've dealt with a new set of circumstances. I also want to take the opportunity to thank Mr. Steck and Ms. Christensen and their staff and executives at the districts for being flexible, adaptive, creative, and collaborative over the past 4 weeks. With that, I'll pass it over to Tina for questions.
Thank you, Minister. For the benefit of our speakers, there are 5 reporters registered for today's announcement. The question and answer session will be conducted in 1 round, where each reporter will have the opportunity to ask 2 questions. Following this, I will ask each reporter if they have any final questions. Our first questions are from Jody Cook, NTV News. Please go ahead.
Thank you. A question about for the junior high students, or I guess, you know, in the middle school, cohorts don't necessarily exist. We understand that they exist on paper, but not for when students are moving out for lunch and that sort of thing. Can you just explain to us how that will look and what that will mean for educators, and if there will be a change to the way operations exist for that age range?
I can provide some response, and then I'll invite Tony and Kim as well if they wish. But we are following public health guidelines. We can control what we can control, and that is the public health measures and the guidelines and requirements within the classroom setting. There is a responsibility for people outside of the classroom setting and outside of school to limit the number of individuals that they have interaction with. Having said that, with the additional protocols put in place as recommended by Dr. Fitzgerald, where masks are required throughout the day, and the fact that students are in cohorts within the class, and that the cohort is an extended bubble, really, for those students where contact tracing would be easy. We have full confidence in Dr. Fitzgerald and public health. They've guided us very well throughout the course of COVID, and even with the new variant, getting that under control. And we will continue to follow the guidelines set forward by public health. Tony?
Thank you, Minister. To be clear, we are following to the T the direction and guidance from the Chief Medical Officer of Health. There are cohorts in the junior high. Where that cohorting would be impacted by scheduling, we've made adjustments. So, for example, 2 classes in grade 9 splitting 4 ways to go to practical fine arts classes. That schedule has been adjusted so that doesn't happen. So we are adhering to cohorts. If it is impossible to adhere to cohorts, then we're adopting scenario 3.
Kim, did you want to make any comment? Or?
Yes, thank you, Minister. So for junior high, well, our groups are small, and as my colleagues have said, we have full confidence in our staff, and we have been very respectful of the guidance of public health, and we are doing as directed. Thank you.
Thanks. Now, moving on to the next question about from an academic perspective. Well, we know that we've talked about not having a crystal ball a lot throughout this journey. But how is this going to look from grading and from an academic point of view, considering we have 3 months left of this calendar school year?
I'll leave that to both Tony, and Kim to answer.
So, in some respects, you look at a situation like this, and there are some silver linings when you have to make adjustments. And one of the silver linings in this particular, adopting this virtual stance, is that it forces you to evaluate your own assessment practices, and it allows you to embrace other assessment practices that we've always talked about. So teachers are very nimble. They've stepped up to the plate, done a brilliant job, and the types of assessments have deviated from the traditional paper and pencil test, which there's some problems with in some cases, to meeting the learner where they are and using varied means to assess where the learning is. So in educational terms, there's a difference between formative assessment and summative assessment. So when you're going through a process of formative assessment, you're looking at where the student is, you're giving them an opportunity to demonstrate their learning. So traditionally, it could be a presentation or a project that takes the place of a traditional paper and pencil test. So those types of assessments are ongoing, they're more frequent. In some ways, I would argue they're more authentic in this environment, and they're giving the learner some choice, in fact, in some cases. But it does present challenges, and I'm not trying to minimize it, but our teachers have stepped up. They've gone into the full suite of possibilities around assessment and done, frankly, a brilliant job.
Okay, and if I might, finally, just the question on Chromebooks. Can you give us an update on where we are for that for those who are returning to online learning?
So for online learning, which is predominantly almost exclusively high school, anyone who requested a device has it. There were some 3,000 requests in grades 7 to 12 province-wide that were fulfilled. There were some 600 homes that were provided with internet access that didn't have it. So now, if anything new or emerging occurs, we'll address it, but there should be no impediment to online learning at this point. The Chromebooks are, there are 4,400 distributed right now, and there are another additional 20,000 that are leaving the factory this month. And we'll have those and distribute those, and they will be nice, and they will augment our capability. But the online learning, the virtual learning under Scenario 3 is not impeded by that delayed delivery.
Thank you. Our next questions are from Richard Duggan, VOCM. Please go ahead.
Thank you. I think this question will be best addressed to Mr. Stack and Ms. Christensen if they want to offer some comments. So students in K-9 will be returning to class, and high school students are going to predominantly be online. How will this look for some of the smaller schools across the province? I'm thinking of the schools in rural areas where schools are, say, K-12, and they have like the full K-12 system in that one small school. I know that some teachers would interact across multiple grade levels. So how will this change affect those schools in which we have the full, K-12 system in that school?
Thank you for the opportunity to clarify that. It's a really good question. There are a number of schools that have the size and the physical layout to be able to remain on Scenario 1, including the high school grades. So they would be smaller K-12 schools. So for example, in Labrador region, there are only 2 schools that have to go to Scenario 3, and those are to be the larger high schools in Menehek and Mealy Mountain. All other schools in Labrador region, as an example, are adopting Scenario 1, including the high school students. And that is repeated in various forms throughout other parts of the province, where if you can, adhere to the Chief Medical Officer guidance and cohort in the high school session, and you have the space, then you're remaining on Scenario 1.
Kim, did you
If I
have
can
comment?
jump in here. So for the Conseil scolaire francophone provincial, given the sizes of our classes, of our groups, all students will be returning to the Phase 1 or to the Scenario 1, and that is across the province.
Thank you. And further to Jody's question, what is the future of final exams and public exams now as we near the end of the school year? Will those be taking place?
I'll ask Tony and Kim to answer that as well.
So in the province made a decision a while back, a welcome decision that we support completely, to forego public examinations this year, given the situation. As well, a lot of our schools met earlier in the year, and their staffs decided to also forego large summative evaluations in this setting. So we're relying on incremental formative assessments, regular, frequent assessments. It is a different mode of operation, as I discussed earlier, but there are some advantages to it. And we will meet the student where they are, give them the opportunity to demonstrate their learning. The marking is still occurring. There will be grades issued, and I have every confidence in the ingenuity of our teaching staff to assess appropriately and to give grades that reflect where the student learning is at the end of the year.
And if I can just jump in again. So the Conseil is doing the same as the English district. So as Tony has mentioned, the public exams have been cancelled for this year, and as the board as well. So we are doing the testing, ongoing testing, or formative assessment, and there will be final assessments, but it will be more adaptable.
Thank you. Our next questions are from Tara Bradbury with the Telegram. Please go ahead.
Thank you very much. This question, I guess, is for the minister. Given the level 4 lockdown still sees us advised to stay in our bubbles and limit funerals to 10 people, we've been hearing from some nervous parents who are asking how it makes sense to send elementary school kids back to school when in some cases, even if they stay in their cohort groups, that could mean 30 kids or more. What do you have to say to that?
Well, two things. First of all, I have full confidence. Let me take this off. I have full confidence in the guidance of public health and the chief medical officer of health. Up until the variant and the spread of the variant a month or so ago, we were the envy of the world. They very quickly gotten that under control, and we've seen a situation now where we've been able to see alert levels dropped. We also take the advice of the Canadian Pediatric Association, where they say that the social, mental well-being of children is best served by children being in school. They have indicated to provinces across the country that they advocate for schools to be open when and where possible because of that. You also look at children of, with a reduced alert level. Many of the children in K to 9 would require supervision at home or other arrangements. The guidance of public health is with the additional measures because of the cohorting that it is safe for the children to be in school, and the balance of risks that it is safer for children to be in school for their physical, mental, and emotional health, and with the additional protocols put in place. Again, I have full confidence in the guidance by public health.
Thank you very much. You spoke about additional contracts for substitute teachers. Has there been any extra resources for janitorial staff in schools who are also, many of them, responsible for snow clearing at this time of year? When it comes to the increased level of cleaning involved, has there been any extra support for those staff?
I will speak to that and then ask both Tony and Kim if they want to respond as well. We, at the beginning of the school year, put additional custodial staff in place from the department had approved those resources, as well as increasing the hours for custodial staff within the schools. Certainly, I think it's fair, with a changing, with the variant and so on. I'm always open to looking at if there are additional pressures to looking at that. But, we had put additional resources in place at the beginning of the year to address the custodial concerns. Snow clearing is an issue every year. Tony, did you want to respond as well?
Certainly, Minister. And we, early on, as alluded to, the province reached out to the districts and asked us what our requirements were, and the additional resources for facilities workers, custodial staff was provided. And it has been, we haven't run into any major issues. There have been some cases where it might have been difficult to find a replacement worker on a given day in a given location. But for the most part, it's functioned very, very well. And if we require revisiting at this stage, then we can certainly look to it, as the Minister commented. But right now, our indications are that there's adequate resources to deal with the situation.
Kim, did you have comment?
Yes, in the spring we did increase the hours, so thank you. Well, we're thankful to the government to support that, and we have maintained those hours, those additional hours. And if we believe that we require more hours, I know that the ministry will be there for us. Thank you.
Thank you.
Thank you. Our next questions are from Mark Quinn, CBC. Please go ahead.
Yes, thank you. I think this is for perhaps Mr. Stack or maybe Mr. Osborne. We've heard from some parents who fear that distancing and mask wearing for 7 to 9 and maybe in other age groups may be a challenge, and they're wondering if this will be monitored to ensure that people are distancing and wearing masks, and would the policy be revised if necessary if it's found that it's not working?
I don't think anybody is under any illusion that we're into a different situation now with the new variant, and people are seized with the urgency of adhering to the public health guidelines, which we support. So in those schools that have scenario 1, face-to-face instruction, that's to be valued and sought after. We want to maintain that, so we're going to go through every possible means to adhere to those guidelines. If there are issues, we're prepared to address them. There's a real sense of urgency, and I think throughout everywhere in the province, prior to the emergence of this new variant, there was some laxing of attention to detail. I don't think we're there now, and we're going to maintain that attention to detail right through to the end of the year. I should also add that, we're going through a lot of measures within schools to adhere to these public health guidelines, and it behooves all the greater community to do the same. If we're cohorting and we're separating and we're keeping to the cohorts, then we don't want that undone by groupings outside of the school setting. So I think, Newfoundland Labradorians have stepped up. They realize this is a whole province effort. And if we all do that and adhere to the guidelines as outlined by Chief Medical Officer, then what happens in the school, the face-to-face, will be able to be maintained.
As Tony, the same thing for the Conseil scolaire francophone provincial, is we're following the guidelines, the protocols, and we're relying on that and meeting with the principals, communicating the messages that we're getting from the chief medical staff, and it's been we're very proud or proud of our staff, students, parents that have followed those guidelines. And as Tony has mentioned, yes, it's a serious issue, and everybody is taking it seriously. They're very disciplined. The students are very disciplined as well.
I should add that our students and our teachers have done a great job, and they do treat it very, very seriously. I'm very proud of them. And when I see children out in the public setting, they're doing what they're supposed to. They're wearing the masks, and as long as we continue to do that, then it puts us in the best possible chance of keeping this virus, this variant in particular, out of our schools.
Thank you. My next question, it's been a difficult year for students in general, I think, but part of the difficulty has been the changing rules, which I can understand why things have had to change. But is this now the way things will continue until the end of the school year, or is it possible that if we change to another level, there may be changes again?
What we've announced today, we will review and revisit after Easter. What I can say with COVID is that it is an evolving and has proven to evolve. I wouldn't say that it would be fair to carve something in stone and say that it is not going to change, because we don't know if the pandemic will evolve further or not. So we will review the guidelines in consultation with public health as we move forward, and certainly the measures that are put in place today will be revisited to ensure that they are still best practice after Easter.
Thank you.
Thank you. Our next questions are from Patrick Butler, BBC Radio Canada. Please go ahead.
Bonjour. Une question pour Mme Christensen. Mme Christensen, pouvez-vous nous expliquer pourquoi c'est possible pour les écoles francophones de la province de passer, de maintenant suivre le scénario 1? Et pouvez-vous aussi expliquer un peu les consignes sur les masques pour les élèves francophones dans les écoles du CSSP?
Oui, je remercie Patrick pour la question. Donc, je vais la répondre en français, ensuite la répondre en anglais également. C'est plus facile pour le conseil scolaire étant donné les cohortes, donc les groupes. Alors, nous savons que dans la région de l'Avalon. Donc, nous avons 2 écoles, une école de la maternelle à la 6e année et la deuxième école qui est Rocher-du-Nord, qui est 7 à 12. Et il y a suffisamment d'espace pour pouvoir répondre aux consignes, aux directives de santé publique. Pour ce qui est des masques, bien, comme nous le savons, tous les élèves doivent avoir porté un masque de la 4e à la 2e année. Donc, c'est comme j'ai mentionné tantôt, les élèves le portent dans toutes les écoles et de la 4e à la 2e année. Donc, nous ne voyons pas que ce soit un problème. Donc, passer au scénario 1, pour nous, c'est plus facile. So the question is, why is it easier for the Conseil scolaire francophone provincial to move towards scenario 1 rather than doing hybrid or to do virtual learning? It's the sizes of our groups in the high school and the space. So we have a K-6 school in St. John's, and that, as we know, everybody's going into in-class learning. But our high school is a 7 to 12 high school, Rocher-Nord in St. John's, and that will provide us sufficient space. There are less students, and we're able to follow the guidelines set by Dr. Fitzgerald and Public Health. And the other question was for the masks. So our students from K to 12 are wearing masks, and they are respecting that. They're very disciplined in doing so, and staff will now be wearing the level 1 mask as well as a visor. Hope that answers the question. Yes.
Absolutely, thank you. I'll ask this question in French and English because there's a bit that I would like the minister to answer. Madame Christensen, depuis des mois, le Conseil scolaire francophone provincial brille par son absence lors de ces conférences de presse organisées par le ministre de l'Éducation. Est-ce que vous allez être présent au prochain point de presse organisé par le ministre? Est-ce que c'est quelque chose qu'on va voir plus souvent? Minister Osborne, the CSFP has been notably absent from press conferences that you've organized over the past few months to deal with education issues. Will we see the CSFP invited to these events going forward, given it is one of the public school boards in the province?
Thank you, and I'll start off, and then certainly Kim can answer as well. We've been in constant contact with Kim and the Francophone School District. The previous conference we had very little impact on the Francophone School District, and therefore, in discussion with Kim, there wasn't a real need for Kim to be involved. This one, obviously, the decisions here today have a greater impact on the Francophone School District. As a result, Kim is online and involved and available. Anytime there is an impact on the Francophone School District, Kim is invited to be here, and I'm sure that when there is an impact that she will. Kim?
Yes, thank you, Minister Osborne. So, yes, as Minister has mentioned, there's always communication. We've been collaborating with Public Health, with the Ministry of Education, with the English District, either in a group or either individually. And as Minister Osborne has mentioned, the last meeting was more towards the English District, and there was limited time. And this time, it was evident that I wanted to be there. Maybe the first time that there was a conference it was new. So, and now the preference will be to be there, and I'm sure that that's not going to be an issue. Alors, la question pour répondre en français, c'est que le conseil scolaire n'était pas présent pour les dernières conférences de presse. Alors, la dernière fois, c'était plus visé au conseil scolaire anglophone, étant donné qu'il passait au scénario 2. Le conseil scolaire francophone, c'était pas le cas, donc et aussi il y avait un temps limité. Mais cette fois, c'était primordial que le conseil scolaire soit là. Et dans le futur, on soit bien et présent. mais il y a toujours eu la collaboration entre le ministère de l'Éducation, Santé publique, le Conseil scolaire anglophone, soit en groupe ou soit individuel. Je suis en directe communication avec le sous-ministre et les sous-ministres adjoints également. Alors, merci.
Merci,
And the final,
Actually, that's two questions. You will get an opportunity for a final round. So our final round, I will go through the registered media once where there will be an opportunity for one question each time your name is called. Jody Cook, NTV, do you have a final question?
Yes, thank you. And this is more just it's a bit of a re-ask, and it's simply because I'm getting a lot of questions on social media around this. It seems like parents of students in junior high still aren't entirely sure on why their kids can return. Some were saying, they've got up to 700-800 kids in that school, and they're cohorted junior highs as well as with the K-9. Some, I understand some have grade 9 in an actual high school. So what do they do about that? Can you just kind of wrap that all up in a nice ball for us so we can understand a little better?
I can certainly attempt to give a complete answer for that. Quite simply, the Chief Medical Officer of Health has set out some guidelines, and the guidelines are for schools that can cohort, we can operate normally. If you can cohort, do the additional mask wearing for grades 4 and up, the additional measures with respect to masking and eyewear for the teachers. If you can do all that, then we can operate in a scenario 1 model. In the case when we have schools, grade levels that are integrated with high school, the scheduling is such they can still cohort. The high school, so I'll give an example. Let's take Menahek High School in Labrador. It's only grades 10 to 12 that will be operating virtually. The junior high grades that are associated with that school, 8 and 9 in this case, would be attending regularly and would be cohorting. In some schools, because of the way practical fine arts were scheduled, and when I say that, that would be music, your art, technology, education as an example. In some cases there, the cohorts were mixed. That would stop, or has stopped, under this arrangement. So it's the ability to cohort. And all of the other measures that are taking place at the school level, and it looks different at every school. I would also like to reassure parents, and I know there's a lot of angst out there, and I understand that. There's angst throughout our community, not just in schools. The public health authorities, our interaction with them time and time again, they have jumped on every situation, contact tracing, isolating students if they had to, making decisions around school. And I expect that would continue to reassure our people. They have been very proactive, and we trust. So we trust in the advice of the Chief Medical Officer. We trust in the ability of the regional health authorities to do what needs to be done if there are any cases that emerge. And we are able to operate thusly under scenario 1. Now there may be a case where a grade 9 it would be apply. I'll give you an example. Holy Spirit High School has grade 9 to 12. In that case, it's the only semesterized school in the Avalon region that integrates grade 9 into the programming. There is a mixing of cohorts because of the way they do French immersion and grouping classes. It is impossible to untangle that schedule. So in that case, and it's a very rare case, then the grade 9s in that particular school would also undergo scenario 3 and be part of virtual learning. But in the vast majority, just about 99.9% of the cases, the 7 to 9 programming is such that you can cohort. And if they're in the small cases where the cohorting was interfered with, that has been eliminated and the schedule has been adjusted.
Yeah, I'm not sure.
Thanks. Sorry, please.
Yeah, I'm not sure if Kim had a comment there as well or not. I'll invite her, but I did want to add to what Tony said. And yes, there is anxiety. There's there's always a level of uncertainty anytime there is change. I will remind that between September and February, I believe we had just one case of COVID in our school system. And again, it was the protocols and the guidelines set forward by the Chief Medical Officer of Health and Public Health that kept us in that good place. With the variant now, there are additional protocols for both students and educators, as well as staff, within our K-9 system. You know, I don't understand or follow the epidemiology, but I know that Dr. Fitzgerald does and Public Health does, and they have guided us exceptionally well. I trust the guidelines that they've put in place, and you know, I trust that it is safe for our students to be back in class based on the cohort and the additional guidelines as put forward by the Chief Medical Officer of Health. Kim, did you have anything you wanted to add?
I think the question was more for the English district, given the size of the classes.
Okay.
And we're able to respect the guidelines in our course due to the sizes of our classes. Thank you.
Thank you. Next, Richard Duggan, BOCM. Do you have a final question?
Yes, I'm getting a lot of questions surrounding what is going to happen next Tuesday and Wednesday from both parents and teachers. Will there still be classes as they look right now on those days, or are teachers going to be using those days to prepare for Thursday? What are those days next week going to look like?
So we're using those 2 days as transition days. So the online learning, example, in the Avalon right now, the K-9 are moving from virtual to face-to-face, and that's set up for up until this Friday. So Tuesday and Wednesday, because Monday's a holiday, Tuesday and Wednesday, the teachers will use that time as well to adjust to having to go back into the classroom face-to-face. And the expectation is that online learning would continue during those days. Now, I would caution the teachers are going to be shifting, so it may not be as robust as it has been. I'd ask for the public's patience in that, parents, but it will still be taking place to a degree. And that'll allow a shift period so that come Thursday, we're able to greet students and have them back face-to-face, which everybody highly values, and carry on.
If I can just jump in, I'll actually just repeat what Tony has said in French because it is the same message. Alors comme la question, c'est qu'est-ce qui se passe mardi, mercredi, étant donné qu'il y a une transition, une période de transition. Bien, lundi, c'est fête. Et mardi, mercredi, c'est une journée de transition. Donc, on s'attend qu'il y ait un peu d'enseignement virtuel, mais ça ne sera pas aussi intense, aussi comme c'était, étant donné qu'on doit permettre au personnel une période de transition pour être en présentiel dès jeudi, le 19 mars. Alors, c'est une période de transition, c'est pour permettre au personnel de pouvoir faire cette transition-là.
Merci. Merci, Kim. Kara Bradbury with the Telegram. Do you have a final question?
I do. Thank you very much. Until the current lockdown, if a child had 2 symptoms, parents were advised to keep them home. Now that public health is asking people to get a COVID test, which is one symptom, if it's a cough or a runny nose, will the school districts be changing their guidelines to require children with one symptom to stay home?
We will follow the guidelines for public health, and they are linked on all of our sites or frequently asked questions, our website. Periodically, those are adjusted by public health, but they're constantly updated. So we follow exactly what public health advises, and that's a really good question because we would like to emphasize that. Again, prior to we were able to keep schools open, we were, as the minister alluded to, an envy of the world, really. And a lot of that was due in large measure to people adhering to those screening protocols, and we were very successful at that. And we are assuming and expecting that parents will be ever vigilant with respect to that and follow the checklist. And if there is an indication of a symptom, that the child would not attend school. We expect that to happen, and we're pleased that it did happen in the past.
Alors, si je peux me permettre de répondre en français, c'est alors on s'attend que les parents, les élèves respectent le questionnaire, l'auto-évaluation. Donc, nous l'affichons sur les sites, le site du conseil, le site des écoles, et nous respectons les changements, les protocoles et ce que Santé publique nous avise. Donc, et on demande au personnel, élèves, parents, de s'assurer qu'on suive le questionnaire d'auto-évaluation et puis s'ils ont un symptôme, de suivre les consignes. Donc, soit rester à la maison si c'est ce que Santé publique a dit. Donc, merci.
Just to be clear, so as long as, sorry. I'm just wondering if you could clarify. So as long as public health guidelines require a test with one symptom, that would be the criteria for children in school as well? Am I understanding right?
Exactly.
The checklist says, if the checklist actually says if there's one symptom, then you should not attend school, check with, call 811 and check with public health. So that carries on.
Thank you very much.
Thank you. Mark Quinn, CBC, do you have a final question?
Yes, I do. Thank you. I'm seeing people asking about busing. I wonder if Mr. Stack could talk about what this means to people who rely on busing.
I'm sorry, you were very low there, and I didn't catch everything.
Oh, I'm sorry. It's Mark Quinn here. I'm seeing some questions about busing. I wonder if you could tell people what these changes mean to busing.
So, the chief medical officer in the prior announcement indicated that there would be no changes to the busing criteria. Now, since the beginning, we've reduced busing capacity from a 72 passenger bus down to 44, and that stays in place. Mask wearing stays in place as well, and that has been really well adhered to. The kids have been great, students have been great. At the bus stop, masked up, boarding the bus, back to front, planned, assigned seating, all of those things are still in vogue, and there was no indication of any changes to the public health guidelines around that. Now, I will say that with the reduction in the scenario 3 attendance, there will be, in some cases, where schools have high school grades that will be on scenario 3 and K to 9, so I'm talking about K to 12 schools here, there will be increased capacity on those buses for sure.
Si je peux me permettre, la question, c'était est-ce qu'il va y avoir des changements au niveau des autobus? Alors, pour le conseil scolaire francophone provincial, non. C'est qu'on continue à suivre les cohortes et les consignes qui étaient, ou les pratiques qui étaient déjà en place. Donc, aucun changement. Puis, selon les consignes de santé publique, nous sommes en mesure de répondre aux directives.
Merci. Patrick Butler, CBC Radio Canada, do you have a final question?
I do. Mine is probably more so directed to Mr. Stack. What I'm curious about for high school students who have learning disabilities, students with disabilities, will they still be able to go for in-person learning? How's that going to work?
Absolutely. So those schools that are going to scenario 3, there will be no change for those students who have complex needs, who were previously identified. They will carry on to being accommodated within the school environment.
Okay, thank you.
Alors, si je peux me permettre, nous, étant donné que le conseil scolaire retourne en présentiel, tous les élèves seront en présentiel, donc on retourne à quasi normal.
Merci. Thank you, everyone. Our time has ended. Minister, do you have any final comments?
Yes, I will make some final comments, and then I'll ask both Tony and Kim if they wish to make some as well. I want to reiterate to our educators, my very heartfelt thank you for the effort that you've put in through the course of the past month, and also to recognize our students who have adapted very well to that change. I want to thank Mr. Stack and Ms. Christensen and their executives and staff, because I think that the transition over the past month has gone as smoothly as anyone could have expected. There's always bumps in the road, but they have done a phenomenal job in meeting those challenges, as have our educators and staff and other stakeholders. I know that I feel confident based on what I've seen over the past month that the transition to where we're going now with these changes should be as smooth as possible as well. I also wanted to thank the Federation of School Councils. I will point out that we'd ask them to go to their membership, the school councils across the province, and get feedback on whether or not we should revert to online learning outside of the Avalon. And I can say that the overwhelming vast majority of feedback that was received supported online learning as opposed to the blended model that we'd seen. So I want to thank them for deploying the consultation with their membership very quickly and getting back to us. And I also wanted to recognize Mr. Ingram and the NLTA in the discussions that we've had through the course of yesterday and again today. Thank you to everybody. Please continue to follow the guidelines put forward by our Chief Medical Officer of Health, and stay safe. Tony?
Thank you, Minister. Just to briefly echo some of that, one thing Newfoundland Labradorians should be very pleased with is the interaction of all the stakeholders that have any hand in education. Our unions, Department of Education, the districts, the Federation. We've had really good constructive conversations that ultimately focused on what's best for students and what's best for the province. So we should be very proud of that interaction. To the administrators in the school who we've asked to plan for scenario 1, back to 3, to 2, back to 3, over to 1. There's been some great deal of movement in that and anticipation, and my heart goes out to you. They're leaders in our system, and those who support them, and all the teachers have really stepped up. Our parents, I know there's challenges here. We will work through as best we can in all areas, and our schools will be responsive where we have the means to do so. Most importantly, for our students who have had to adjust to masks, have lost some of their fun activities, we're going to try to make it as engaging as we can, be it virtual or face-to-face. We want what's the very best for you, and we're ultimately concerned with your safety, and we will do what's right for you throughout all of this. And I just want to thank you for your patience and understanding.
Kim?
Thank you, Tony. Kim, do you have any final comments?
Thank you, Minister, as well. Je vais le dire en français. Donc, nous, c'est pas un temps facile. Cette COVID, ça fait déjà 1 an. Donc, nous, on aimerait sincèrement remercier tout le personnel, tous nos partenaires, le ministère de l'Éducation, Santé publique, le Conseil scolaire anglophone, le NLTA, la Fédération francophone, la Fédération de parents, l'association, tous les gens qui sont impliqués dans nos centres communautaires. Donc, ce n'est pas un temps facile, mais les gens, ensemble, on est restés solidaires et on travaille ensemble pour pouvoir assurer la sécurité de tous. Donc, merci aux parents. Vous avez été très, très patients. C'est pas idéal toujours. Les élèves sont, comme M. Stack le mentionne, n'ont pas tous les activités. On comprend que le social est important, mais le personnel essaie d'assurer cette créativité-là pour assurer l'apprentissage continuel et que tout le monde soit heureux et en sécurité. Donc, merci. Thank you for all, thank you for listening, and everybody stay safe. Merci.
Merci, Kim. That ends our session. Take care, everyone, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.